did, I know. Okay. This is the Community Wellness Committee. Today is Wednesday, December 11th, and it's 5 p.m. I am here. Katie Leparish, the chair. I see Elaine Bourgeois-Capoli to my left. We have an upcoming member who was invited but doesn't really take his seat until January, so it was not required to be here. And we also have Dr. Georgeson joining us, which we appreciate very much. And in the audience, we have special guest Jennifer Hill. City Clerk Carrie Harrington is here. That's everybody in the room.
Thanks.
I looked at the minutes from October, and I thought they looked good.
Yep.
So if it's okay, we can approve those by acclamation. I feel like we'll probably spend the bulk of our time on this tobacco-free communities legislation, so let's do topics A and C, not to rush them, but just to make sure that they get in, and then we'll know we have the remainder of our time for the tobacco-free communities legislation.
Yeah.
So,
Sure. So, I wanted to keep addressing homelessness in the community on our agenda because I know we have kind of touched base about this, but the Safe Homes and Neighborhoods Task Force is no longer operational.
right.
So the discussion had been, to bring those topics into this committee. And I had seen, and I'm sorry, I thought I had it handy, but I don't. We can look it up if we need to, that, I found the original charge for, the committee it turned out, and I saw homelessness was definitely in there.
For this
So,
one.
yes, so
Yeah.
it is, for sure the right place for it to be.
Yeah,
I
for
confirm.
sure.
Yeah, so I just, I have been doing a lot of work, with different, contacting different agencies, participating in some group discussions, like one that the United Way is organizing around homelessness in the community. That's the one that you had sent, actually.
Oh, good.
Yes. So I got connected up with them. They're meeting again next week. But there's a lot of agencies we know involved in this work locally. And then the week of Thanksgiving, WKTV from Utica came and did a news piece here in Oneonta about homelessness.
Okay.
So that is available on their website if anybody wants to check it out. I shared it on my Facebook page as well. And they interviewed folks from Catholic Charities of Chenango County that is operating the SOS program, the Safe Options Support Program, which is doing outreach and identifying and making connections with folks who have been chronically homeless. There's several other agencies that are also providing services, like we know OFO, Opportunities for Otsego. We had a representative here, I think maybe at that October meeting, right?
Toya was here.
Yeah. So there's agencies like that, Family Service Family Service Association. There's also Catholic Charities that's right here in Oneonta that is also providing services and operating the warming center. There's Code Blue, and then there's also 211, which is a referral line that can be a starting point for services. So I have been making some contacts. I was hoping MCAT might come to this meeting because they were supposed to come to our last meeting.
Yeah.
She's not available, so I'm working on that for January.
Okay, great.
But the agencies that I've spoken with like the idea that I think I mentioned to you, Katie, about just continuing to invite folks to come to the meeting, to make a presentation to this committee about what work they do, and then we can also help share that work with the wider community. And just to help with strengthening any of those connections that the agencies already have, and just helping to in whatever way we can.
So much of this work was done by this committee in that big forum we held at SUNY Oneonta.
Yep. And I've heard a lot about that.
So I guess the question I would ask is to what degree is the city, and then in turn this committee, responsible for solving the homeless problem in Oneonta? I mean, it's a huge charge. The problem is very heterogeneous. There are many organizations already working on it. So I appreciate that you've done all this work in coming up to speed about what resources are available. We had a number of meetings when we decided that this was an important issue, where Chief Witzenberg spoke to his perspective. So I guess to be clear, I would want to know what this committee proposes to do. I mean,
Yeah,
are we
right.
taking one piece of it? Is it about the downtown presence? Is it about coordination of resources? I'm not really even sure that's our charge. Mark, who led this committee for years, Mark Davies, seemed to think that, you know, we did some good in creating that day-long meeting where we brought together people from the community as well as outside of the community, the whole county, and we had a representative from Utica there. But again, it's a huge problem, Elaine, and I'm not,
Yes,
I would
yeah.
want to be very clear about what the wellness committee and the city in turn. I watched that clip and I heard you mention that the wellness committee was gonna help solve the problem, but again, I think we need to know exactly what our role is
Yeah.
in the problem and how we propose to be involved. And I would want a directive from the mayor perhaps, what he sees our role is in a problem with a huge scope.
Yeah, so personally, what I see it as right now is awareness raising, you know, getting, you know, the information, you know, and connectivity that way. You know, with the public, you know, being more aware of what's going on. Because personally, I hear a lot of questions from the public, and I don't know if you get questions too about like, what are we going to do, you know? And I agree with you, like as far as like the funding and stuff, you know, a lot of that comes from the county level, right? So I've been going to their human services meetings, and you know, even food security is coming up, you know, now, as I know we've talked about it here as well, but you know, some of those networks and systems that we've come to rely on are losing funding, you know, they're losing staffing, you know, so those some of those security nets are not as strong as they used to be. So I don't know that I have all the answers to what exactly the Community Wellness Committee can do, other than, you know, like I said, you know, maybe help with some of those connectivity and awareness. But beyond that, yeah, I think we can be open to, you know, what direction we take that in.
So, yes. To Dr. Georgeson's point, like
Yeah.
we did have that one that was gigantic, and then after that we've had sort of several smaller forums, and there was feedback from all of these providers that you've been in touch with that kind of acting as a facilitator for communication between those services was really helpful. That can be as simple as organizing a meeting, and maybe trying to get some infrastructure in place for those meetings to continue without us being the ones needing to organize them. I know that the Community Solutions Panel is doing that as well. I think that I don't know that having like individual speakers come, although, you know, we would be taking a deeper dive into understanding what organizations do on a daily basis, and I don't think there's any harm in that. But I think that what I heard was the value was in getting multiple people in a room together, so that,
Yeah.
because, I mean, we don't have members of the public here, so in terms of raising awareness, it's really just for our, I think, understanding, so that we can be more confident when we
Yeah.
speak. And I know that you're already doing so much work outside this committee in order to become aware. But I agree. I think figuring out what we're gonna do, like what bite of the elephant could be ours, is really important. One thing that we have talked about that was loud and clear from all those organizations when we had food insecurity, when we had children's mental health, when we had that big provider summit, was the network of volunteers is dwindling. And we had spoken previously, I think it was this year in this committee, about something specific that the city could do, which is volunteer coordination, which is sort of what you're
Yeah.
saying, which is like connecting the public with what they can do to help sort of solve the problem. And that is something that, you know, obviously the mayor loves to find a niche for someone. So when that was something that he was really excited about. He had mentioned, probably over the summer now, maybe connecting with some students who are involved in computer programming, software development, something like that, to try to create something on our website that would be like, you know, if I'm someone who has a little bit of time, I could log in and say, I can volunteer on Tuesdays from 2 to 4. Who needs my help? And vice versa, right? That
Yeah.
our organizations could put out a call and say, you know, Saturday's Bread consistently needs volunteers at this time, XYZ, so that people could sign up. So again, like facilitation, to your point, and yours actually about the county, like we're not gonna be funding anything,
Right.
we're probably not gonna be solving anything. So on our own, you know, one meeting a month at an hour each clip, but looking for ways to like further the mission of people or connect people, I think is a good for me in terms of the future of this community or this committee on that topic. I think that's probably the most successful route we could take. That being said, I'm so not opposed to like having guests and learning and all that, but I like the idea of like, okay, so what are we gonna do with that information?
Yeah.
So I think we can maybe take, like, I think for me, one step is following up with the mayor and seeing like where he is with that. I feel like he came a few meetings ago and maybe mentioned that he had made some headway on that, but I don't really have a concrete thing and a concrete update. So I think getting an update on that would be a really good place to start. Because I know that the volunteer base is really dwindling, and that really hampers the amount of work that all these organizations
Yeah.
that exist in the space can already
Well,
do.
and I'm trying to think, I can't remember which organization it was, but when I was involved with the Oneonta World of Learning, there was an organization locally that had like a volunteer database going on. And I can't remember, it was
Okay.
one of the ones that's in Row House. I'll have to backtrack and figure out who that was doing it. It might
On
have
Row
been
House
United. No, the Row House. Yeah.
Oh.
Was it United Way? Do they have an office there? Maybe. I'd have to double check. Who it was, because this was several years ago.
Okay, gotcha.
So I was doing some volunteer coordination for that organization.
Yeah, I mean,
But-
there has to be, the thing is, we could create something, but then it can't be static. So
Yeah.
the question of who's gonna maintain that and keep it up to date is an
Yeah.
issue also.
Well, and if they already have a database going, maybe we could help lift that up and make people
Right,
more
just
aware of
link
it.
to it.
Yeah,
I
because
mean,
exactly, like we don't want to recreate the wheel if
Right.
it's already out there. Let's just
Right.
help it keep going. You know.
Right.
So okay.
Yeah. The other thing I think we could do is, an issue was just brought up. It's funny how all these things intersect, but an issue was just brought up by a member of the Health and Human Services Committee from the county with regard to lack of parking
Yes.
for
That was
employees of Otsego County Mental Health.
Yes.
And recognizing that they have been parking for their workday and getting tickets
Yeah.
from parking for their full workday. So we could, that's something that has, I think, a more immediate short term, like,
Yeah.
we need to not be like, they're having a hard enough time recruiting and retaining people for that
Yes.
office anyway, so like, let's not make them not wanna come to work. So I would be open to discussing that as well, like, what we think we could do. She had suggested even just issuing a few parking passes that they could
Yeah.
give out to
Yeah.
people as they, okay, you're working tomorrow, here's your pass, and then that way, OPD would know not to give tickets to
Yeah.
them.
Mhm.
I think that would be a pretty simple solution. I know where I work, we did that because we had trouble with people. And the enforcement isn't, very strict where I work, but that way if there's a strange car and they don't have a sticker and we can't locate them in the building, we know, that it's safe to, we just leave a nice note. But anyway, it was a pretty simple, effective solution to that issue. So that's something that I think the city could probably handle. We could print half a dozen stickers and make it easy enough for them to just throw it in their dash or whatever. I don't know. What do you guys think about that?
I think it's a great idea.
Yeah.
Okay.
Yeah, I was at that meeting and it came, when that came up and they asked me about it and where folks could park, and I
Mhm.
directed, a couple of the, spots that are available, for all-day parking. And they also express that part of it is that, because these county folks, because they're understaffed, they're also very busy. And so they're scheduling, appointments through their lunch, so they don't have time to go move their car, and
Right.
they don't always really want to park far away because of the nature of their work. There have been times that some of these workers, I guess, have been targeted,
Right.
so there are safety concerns along with that. So
Yeah.
I think a permit parking, some kind of solution. I mean, I know that overall the city is talking about, moving towards more managed parking, but it's
Just
an
short
immediate
term.
issue that came up because we have a parking enforcement now.
Yes,
And
which is great.
So yeah.
Okay, so I think that we should probably make that as a formal recommendation
Yeah.
from this committee, that in the best interest of the access to mental health services, that we allow the members of the Otsego County Mental Health to have permits that would, absolve them from parking regulations and parking tickets. And not to get too deep into the weeds about parking, but I think a lot of people who work at City Hall park in the Deeds lot, and they are moving their cars, and it's we're parking there all day. And so I think one of the suggestions that was made was to park in the Deeds lot, which is pretty far away
Yeah.
when you might be followed, But then I was thinking about all of our City Hall employees who park up there, and I was like, oh no. So, but I think that this is good. It's within the Otsego County Mental Health is within the purview of the committee to make that recommendation. So, and hopefully we'll move toward better managed parking soon. Okay, so we'll make a recommendation.
Yeah, and then the other thing I just want to add, just going back to the discussion about what is our purpose, with talking about homelessness. The other thing is that the community wants to know that the city is addressing it somehow.
That's
and
true.
It's true that we don't have funding and things to back it up, but I think what we can do is just help make sure that the conversation is on the radar, right?
Yeah, good.
Yeah.
Yes.
Cool. So we will hopefully host Denise from MCAT in
Yeah.
January, and then we can just kind of rotate, I think,
Mhm.
after that. And if we can get multiple people here and they can kind of riff off each other, that would be good. Again, like I said, I know that a lot of the ahas were in things where we were having this group conversation and someone from another organization
Yep.
would say something and they would go, oh my gosh, and then a connection is forged that way.
Yeah.
Even just like you said, just getting people to talk about it allows for more collaboration. So, okay. And then the website thing.
Yes.
Yep. And we're gonna check to see who might have an existing volunteer database.
I'm gonna check and see. This
Okay.
was years ago, so I don't know if it still exists. But again, if it already exists, we shouldn't try to recreate
Right.
it.
If we don't have to recreate it, that's great. And one of the people who's knocking on my brain right now is Reverend Cynthia Walton Levitt, who came to this committee a lot of times to talk about volunteerism in the community. And if we have I'm gonna review all my materials from her because she's very generous with the information that she will give, and just to make sure that I'm not being redundant, but she might be someone that we can use as a resource in terms of somebody who's done a lot of the recruiting for volunteers work, and to say this might work and this might not work, and things like that, just to help us as we go. So, in terms of also not reinventing the wheel. So, okay, do you all mind if I take 30 seconds and just write down my thoughts so that I don't forget them?
Yeah.
Because they're in here, and if I put anything else in there, I'm gonna forget. say on that topic before we move on? Okay. Would you like to update us on Otsego Safe? Were you
Yeah.
able to go to that?
Did.
Thing? Okay.
I went to it was a statewide conference on suicide prevention. And I went to that on November 13th and spent the whole day in Albany with other folks talking about initiatives and ways to address, and prevent suicidality. And there were a lot of resources, shared there. And other than that, the Otsego Safe Committee has not met this month. They canceled their December meeting, and they are going to meet again in January. But they're working on some new initiatives, like a men's shed initiative. The idea is getting men working together, doing like projects, because
Okay.
they're less likely to, participate and benefit from, groups, I guess,
Uh-huh.
So they're trying to do some
Activities.
things. Yeah, they're trying to do some things to address different populations, like
Nice.
that. They're working on some trainings. There's going to be a project with bookmarks coming out too that are going to be distributed amongst the community with different messages.
Cool.
So that is really all the updates I have, about that. But I'll
Okay.
continue to bring any other ideas. In a kind of related vein, there is a group that provides behavior therapy services that is looking to open up in Oneonta, I guess. And they have an interest survey out. I put it on Facebook, but I
Okay.
can certainly email it to folks if you're interested too, because they're just looking to have families answer questions about services that they might be looking for with their children.
Okay.
So it's services for children and families. And it's called Altogether ABA. They have an office in Norwich, and they also operate out of Connecticut, I guess. I think Connecticut is where they started.
Okay.
But yeah, I have worked with some folks that have had some good experiences with them. So just bringing more of those, mental health and wellness services to the area is, I think, beneficial. So,
Yeah, definitely. That's something I'll take a look at, and
Yeah.
if it's appropriate, I might share with the school district to see
yeah.
if they could get
Yep.
out to families,
Yeah.
because, or even just share in family, Facebook groups and
Yes.
circles and
Yeah.
things like that, because that is something. Children's mental health is another thing that I think is in our charge.
Oh, yeah.
In terms
Yeah,
of,
And
it's definitely something that we discussed with Chief Witzenberg when he was coming regularly about ways to kind of break the cycle in our community and
Yeah.
basically pouring into kids so that they grow up to be healthy adults.
yeah.
And I know that from experience experience with the district and through that, we had a children's mental health meeting with various people that it's really, really a big concern.
It
So,
is. And there's
there
definitely a
just
shortage
aren't-
of providers.
Yes.
So I'm really
Took the
glad
words right out
that,
of my mouth.
there's one coming here, because they did cover the area, but it's always better when you have a physical location
Mhm.
where people can, go and connect with those services and get on-site services. It sounds like they might even be talking about some things like play groups and stuff. So
Cool.
beneficial for the kids as well as for the families in general as well. So, yeah.
Awesome.
So what kind of providers are they?
Behavior therapists. At least the ones that I worked with, like they work with the family, and you can even work with the school district, at least in some instances, to help address, concerning behaviors that the child might
So
be
they like
having.
license?
Yeah.
Is that a thing, behavior therapy?
I don't know what their license is, but I know that they are, I think it's certified behavior therapist is what they are. I'd have to double check, what their actual credentialing is. But yeah, they provide direct services where they work, with the child. They work directly with the child as well as the family to, develop a behavior support plan, for that family. And then in some instances, at least they've even pushed into the school where they can work with the child in the school and also help the school district with some strategies as well
So how are they funded?
through Medicaid.
Applied
So, or other,
behavior-
insurance. I say Medicaid because that's what I'm familiar with
Oh,
from
gotcha.
work, but yeah.
Applied behavior analysis and autism therapy. What to expect during your visit. Interesting. Yeah,
done some really good work, I know, already from my experience. So I was happy to hear that they're gonna be expanding into Oneonta. Stay connected.
This person's an educator, social worker. A lot of abbreviations that I'm not sure what they mean, so I would check it out.
Yeah.
This person is a therapist. Cool. Awesome.
Mm-hmm.
Yeah, if you could send that
Yeah,
link.
I will send
Great.
it once I can get cooperation here, you know?
Mhm.
It was connected, but not at the moment, so I'll get to that.
Well, at least we have power.
Yes, at least we have power, and I'm sorry if anybody else here lost power. It sounded like it, was it restored?
It's restored.
It was restored, right?
Yes.
Okay, thanks. Yeah, let's see. It says it's a BCBA credential,
Okay.
whatever that means.
Cool.
So-
Yeah, I'm excited. I mean,
Yeah.
we certainly need more providers around here, so
Oh,
it's
yeah,
cool
I
that
agree.
they're interested. Okay. Okay, tobacco-free legislation, we have 31 minutes until they kick us out, and I'm so excited to spend it on tobacco legislation.
You don't hear that honestly.
So, if there's anything that you would like to say, present beforehand, I know you've come a few times. I basically at our last meeting we said we were going to look at the Town of Bethlehem statute, and I've also printed. So my dog ate my computer charger, and then I bought one. Seriously, and then I bought one, and it doesn't give consistent power, so I had to return. So anyway, I have to buy a new one.
Oh, gosh.
So I'm like very analog these days, or my tiny computer, you know. But I printed from the Public Health Law Center. It's a model statute, so it's very bland, but it's also very comprehensive because they want to throw everything in there so you can strike out what you don't want.
Yeah.
I have also printed the Town of Bethlehem thing, which is what I had asked everyone to look through, so I think we'll probably start there. But then I also saw that the city of Cortland passed this year tobacco limiting legislation, and it looked, when I was reading through some of the cliff notes of it, it seemed like a lot of the things that we may want to incorporate. So I've also printed that one just for my own reference as well, but I can share it too. I just didn't get a chance to do that. I have a few, excuse me, random papers here that have like one bullet point on them that I'm like, oh, I don't want to forget that, so I have those. And then I gave everybody just like a quick little spreadsheet, because what the Public Health Law Center kind of guides you through the process and like recommended steps to help make the legislation successful. So it's kind of like the website thing. We can build a website, but if we don't have anybody to maintain it, it doesn't really mean anything. Same with the legislation. We can write the legislation, we can hopefully pass the legislation, but then we have to figure out how we're gonna enact it and keep it going. So the first thing that I thought was really helpful, this is from a publication of theirs, said to identify the retailers excuse me, that would be impacted within our jurisdiction. And so I went to one of their recommended websites, and only one of them. So what I noticed is that all of our stores that sell tobacco are not on this list. That doesn't necessarily mean that they don't have a license in the state, because I did not check everywhere on the internet for that. But I did think that was interesting, because if we do our due diligence and we find out that some of these places don't have a license to sell tobacco, that would be something that we would want to communicate to the county and the state.
I see, and you know what, I see the top is city and the bottom is town, okay.
Yes,
Yep.
So they don't give you that information, and so if any of these are wrong, that's me going,
Oh,
yeah, I
yeah.
think that's in the city.
No,
Yeah,
I,
so
well,
partner with the town about? Or, I mean,
Maybe.
if we were to pass legislation, say, for instance, requiring licenses, which is kind of
Where we're headed.
the point
Yeah.
where we're headed, would it be useful to have discussions with the town as to whether they would want to pass similar legislation?
Mm-hmm. I mean, from my perspective, yeah, that'd be great. I don't know that it's necessary in
No.
order for us to do it, but I think it would be
Yeah.
great.
Like
Because-
consistency, right? You know?
Yeah.
So,
Yeah, I mean, just in general, thinking about the fact that like you can walk from your house on West End Ave to the whatever it is out there, exotic something or other, which actually I think closed. But you know, it was funny because I was thinking like, oh man, I kind of want to include that one because it's so close and it's right near a residential area
Right.
and it's really close to a school. And, you know, but I was like, but it's in the town, so I won't,
Yeah.
so it's kind of at the
Okay.
bottom here. But yeah, so I think that's a good pursuit, like if we can do that, to at least just broach the topic of like, we're gonna do this, is this something you would be interested in? Cause theoretically, we could even provide them with our legislation as a starting point, right, for them to pass their own legislation.
Have you talked to who in the town, Jennifer, would you know?
I honestly haven't talked to, anyone from the town government in a while. And, you know, I knew Bob pretty well, Bob, as did everyone, but,
Yeah.
but, yeah, I'll have to look back, and see, and even refresh my memory of who's on the governing board, but, you know, I think definitely, if the city of Oneonta passes a, you know, tobacco retailer licensing law, it'd be great as a model for this area, you know, town of Oneonta certainly, but also, you know, even other municipalities nearby.
Smaller,
Yeah.
yeah.
Yeah, but, yeah, I can, if you want to, I mean, I can reach out to them. I mean, you know, maybe they would want to come to the legislative committee meeting, or, you know, one of them, or,
And like
or,
work on this with
like,
us,
yeah,
or
if
give
you
input.
introduce this legislation to, either to pass or not, in the common council meeting, maybe they'd be interested in that, so.
Yeah, that would be cool if you would be willing to like liaise with them.
Sure.
And I know someone on the town planning board. I don't know what their structure is, you know, their process. I know they have a board, but I don't know what, like things go to committee here first and then they go, I don't know what they do out there, which is
I'm not sure.
kind of startling, I guess, now that I think about it. But I'm just like, they just do what they want, but it's,
I think the town has a health officer, especially
Really?
during COVID. It
Okay.
was Nick Terraconi, and I
Oh,
interacted with him
yeah.
some, so
Okay.
I can look into that if you want me to.
Yeah.
cool, yeah, that would be great. I think, thank you for bringing that up, that's a really great point. And I think it could alleviate some pain points with regard to, I mean, the idea is that the impact is kind of at a subconscious level on smokers because we would be limiting the number of shops, we might be able to impose some sightline limitations on signage. There's some communities that have done that. So I mean, it wouldn't be things like, well, you can't buy them here and you can buy them a block away. So from that perspective, like the average resident probably wouldn't know, but I think in terms of like business owners, to be able to buy a business here and not need a license, but if it's a block away, you do need a license, you know, they might be, so it might go over better if it's, yeah, okay, cool, coordinate with town,
Yep.
good
And
suggestion.
Since, you know, this committee's already taking the lead on writing, you know,
Mhm.
crafting that, you know, that could at least be, you know, potentially, you know, one thing to help them, right?
Right. Yeah, we're basically like, we'll do the work if you guys wanna pass it.
suggest, yeah, take that on, you know, once it's,
Mhm.
you know, crafted and, yeah, see what they think of it too.
Well, and that's, you know, that's why, you know, we'll send out like the town of Bethlehem's policy, cause, you know, it's also nice if someone doesn't, if another town doesn't have to reinvent the wheel.
Yes.
Totally.
Yeah, and again, you know, the policy can be about, you know, like, if you wanna decrease the number or density of retailers in a certain neighborhood,
Mhm.
or section like, you know, downtown Main Street, you know, it's not that you would like, I don't know, eliminate all, you know, tobacco retailers or even, you know, probably wouldn't wanna do that for the ones that are in existence right now. I'm not sure you could, but, you know, it's sort of trying to manage the number and density.
Mhm.
And just so you know, I mean, this is in terms of smoking and selling cigarettes, but, and this is nationwide, but cigarette sales generate little revenue and low profit margins for convenience, you know, stores like convenience stores. So they only account for 10% of overall in-store sales revenue, and cigarettes have the lowest profit margin for convenience stores as opposed to other product categories. So food services have the highest profit margin. And this data is from the 2021 National Association of Convenience Stores State of the Industry Report. So I can forward you this, this sort of document that tobacco-free communities in the Capital District put together. So, you know, the whole idea is, you know, just because, you know, tobacco retailers may be more limited, it shouldn't affect their bottom line unless, you know, it's a smoker's choice kind of place where they're
Yes.
selling more.
I saw that on the FAQ from the American Heart Association. I thought it was really good about answering a lot of the like potential concerns of business owners.
Right.
Because that's basically what they said is like you can still own a business. You don't need a license to own your business unless it's like a tobacco only business. But you just wouldn't be able to sell tobacco. So, for example, and I used to United Food Market a lot because I go there a lot. They would still be able to sell delicious food and you know, soda and ice cream and whatever. They just wouldn't be able to have tobacco if they were denied a license. So it
Or
doesn't.
if they didn't wanna buy one, I guess.
Right.
Yeah.
Yep. Okay. So, what I read about FAQ. What I read about the policies, the model statutes, is that the most effective regulations are a combination, and they're also the most equitable. So, instituting licenses, and they can be for a flat number, they can be diminishing. I think Portland is diminishing, so for every, they only issue one for every two that are not renewed. And then and then fees, of course. And they, one of the things that I printed was about, in terms of setting fees, and that might not be anything that we get into, but just for knowledge, is like recognizing the cost of licensing, the cost of enforcement. So it's sort of like that administrative fee thing where we're, you know, trying to build that in so that it is an equitable fee assessment rather than something that is like, you know, punitive or exorbitant. So, so licenses and then zoning. So distance from hospitals, schools, and child-focused places, and each other, which I think would help a lot with the density, specifically on Main Street, where we're seeing a lot of them pop up, like one on every block, or like I'm thinking about, and actually incidentally, this list does not include any of the ones on Main Street at all. So it was
Yeah,
kind
I
of
was wondering
weird.
if this was really the true number, because when I saw the total list, I thought, oh, okay, that's probably, but as if it's half in the city,
And half
I
in
think
the
we're
town.
missing some, right?
Yeah, they showed 26 with the 13820 zip code.
Okay.
But I know that there's the new Food Mart, which is where Shakedown Street used to be. I'm
Yeah.
pretty sure they have tobacco.
And right next door to where our office used to be.
Right.
Yeah.
That's right. And I know United Food Market has tobacco.
So, and those are newer, so maybe, I don't know what
I know.
the database, range is or whatever, how often they're updated.
That's true. So, and the one that is over here, Area 51, which
Yeah.
is a smoke shop, that wasn't on there either. And I thought of them because one of the communities limited, like, illuminated, neon, flashing
Oh, I remember
signs.
there was a thing with the sign.
Yep,
Yeah.
and they had an issue with their sign because they put up a sign that
Yeah.
my 5-year-old thought was really cool. And so I thought of them and I said, oh, they're not on the list either. So
Yeah.
one of the things I wanted to do was try to look at this and see if there were any off the top of our head that we could think of that aren't on the list, so I could kind of seek out whether or not they are registered. Because they were saying that creating a GIS map. Oh, that's not it. Where am I? Oh, it's in this packet that I have. That creating a GIS map can be really helpful with regard to, like, if we're gonna do distance from, maybe I didn't print it, from, like, schools and hospitals and stuff, like, doing a GIS overlay of, like, what 500 feet looks like, and
Yeah.
seeing how many are within that, and then, those are obviously businesses that we would wanna grandfather in for at least the first year, and then they would have to, apply for a license to continue. But then those would be exclusionary zones, after that, once those licenses expired or were no longer renewed or
I was
whatever.
gonna say, that's the idea, is that, like you said, the expiration and kind of phasing, things out, so that,
Yeah.
which was the idea, like 2 to 1, some
Yeah.
way of limiting it, yep.
And so what I'm thinking is maybe for the next meeting, if it's possible, if we can come up with like a comprehensive list of these addresses, maybe we could ask someone to come up with a GIS map for us of what some distances might look like. Do you guys have any idea of, well, let me put this out, because rather than just being vague.
We could do that.
Oh, really?
Yeah, in fact, that's the kind of thing we tend to do.
Oh,
We do-
okay.
They're called local level evaluations, and so.
Yes, please.
That's what we need. Let's have it, yeah.
Woohoo, thank you.
I'm sure Carrie would be heartbroken.
I know.
Loving that
But I think we
GIS.
can, I think that's okay then.
I know. And it's funny because I also sit on the legislative committee,
Yeah.
and I feel like everything we do is basically like giving Carrie homework.
Oh.
So I just like looked at her and I'm like, do you think somebody could make us a map? I'm so sorry. Okay, so that's wonderful.
So you're the someone.
Yeah.
So, I'll have us work on that.
Awesome.
Do you need the list then? Should we still work on a list and identifying if there's other
I will take this, but I think
Okay.
our list might even be
More.
more updated
Okay.
Sure.
than that
Yeah.
one.
Because
I think we did one about a year ago.
Yeah.
Okay.
I say I got fooled. I saw 51 on here, and I thought that was the one that's
I
something
know,
else.
but it's, I know. 5-1
So-
vape.
Yeah. Okay.
Yeah, that's so funny. So, okay, awesome. Yeah, and then if you need us to do any sort of anything to support that, that would be great. I'm happy to. But yeah, and then so the recommendation in terms of the most effective, but I don't know well, and maybe this is something that y'all would make recommendations on, but like, they were saying, 1,000 feet from hospitals, schools, and child-focused places, and then 500 feet from each other. Do you feel like that's at least a reasonable place to start to look at what that's the recommendation of the, I wanna say it's the American Heart Association, but it might actually be this Public Health Law Center.
Yeah, and I always have to look at New York State law on,
Okay,
cause there's already a state law on distance from tobacco retailers and schools.
okay,
And I think it might be 1,500 feet, but,
1,500, go New York,
but,
right?
let me check.
Sure.
It might be 1,000.
Okay,
But if it's already 1,000 or 15, it sounds like, you know, we could either have to increase or, you know, maybe, I don't know.
yeah, I mean, we have to meet the state minimum
Yeah.
for sure, but we can
Yeah.
be more restrictive than the
Right.
state if we choose
So we
to
can,
be.
yeah, consider if that's adequate enough, you know,
Yeah.
looking at those maps, or if we feel like, you know,
Yeah.
a greater distance.
For sure. I
Should
mean, and
be
I think one of the
established.
things that's interesting about looking at those maps is
Mhm.
like the pockets that they
Yeah.
create is realizing like, okay, so if they can't be in these areas, then they're gonna be here.
Yeah,
Is that where we want
yeah, and
them
then kind of
to-
identify that, you know, what's left.
Right.
Yeah, that's a good point, because once we pick out space for our hospital, the multiple schools, you know, yeah, that's a good point.
Yeah, so New York State law, and this just passed, I think, in 2020, prohibits smoke shops and tobacco retailers within 1,500 feet of
Oh.
another smoke shop,
Okay.
Whoa.
tobacco,
Wait, really?
smoke shop or tobacco
And these,
retailers.
again, would be for new licenses, so ones that already existed might, you know,
Right.
yeah.
Right.
School, playground, childcare facility, public library, place of worship,
Okay.
or municipal park. Let me.
Wait, really?
Okay.
So how does like the quick fill and the 5-1 vape get away with being so close to like Huntington Library and
I'm guessing
Huntington Park?
because they were there
Probably pre-existing.
before
There
that was set up.
Oh.
There might be a clause for.
Yeah.
Okay, this is gonna be fun. This feels like a puzzle
Yeah.
that we're gonna have
You
to
know what,
solve.
I hadn't thought about it that way too, like, you know, like, okay, exclusionary zones, but then looking at what does that, what remains,
Right.
you know, and yeah, like you said, are those pockets that we would want to, you know, push, you know, things into, so I think that'll be really interesting to see,
Really interesting.
you know, just what that looks like.
Yeah.
It's one thing to talk about it, but it's another thing, I think, to visualize that.
Well, and so one thing that a community did, so I'm not sure where I found this website, definitely linked from the Public Health Law Center,
Yeah.
but they had the model, or they had the statutes from basically all of the municipalities who have these types of laws on the books. And they had cliff notes pretty much from each of them. So if I can find that again, and I can because it's the internet and they track you, so I'll be able to go back in my history and figure out where I was. And I'll send it to you guys so you can kind of play around there because one of the things that at the time I felt was like really limiting language was like also within two, like it limited them within or excluded them within 200 feet of a single family or two family residential primary use. I don't know why my tongue is so twisted today. Which I thought was pretty limiting, but we might be able to do something to say, because like for example, like the Hometown Deli right now, which pretty much only sells tobacco and beer, would not qualify, but we might be able to say something like, in the definition of neighborhood market, we have tobacco, and when we were looking at that legislation, I had the kind of impulse to add tobacco limiting legislation into that. I don't know that we actually did, but that might be a place where we could say, like, unless it's defined as a neighborhood market and tobacco sales are an incidental use, not more than
Okay.
XYZ of the square
Gotcha.
footage.
So.
Because we did that in terms of like, it's not a restaurant if
Right,
your tables are only 10% of your square footage or something like that. So
okay.
we could say something like that if we wanted to, if we felt like this map and these exclusionary zones would push new tobacco businesses into residential neighborhoods, we could maybe be like a little bit more crafty about what we would want that to look like, I think.
I'm still trying to find, to make sure what I told you was correct. about
Okay.
The distance, 'cause
Well, we still have like 8 minutes, so so that's good. But I have a feeling we're going to end up talking a little bit more about this in the interim, and then again at our next meeting. So we didn't do what I wanted to do, which is like old school, go through this legislation and say, all right, what does everybody think of that? Like, what do we think of section 1? And that's kind of where we left off at our last meeting, was we were gonna do that this meeting. So I hate to say, can we do that next meeting? But I think that is probably where we're headed, because we're definitely not gonna get through it in 8 minutes. But that does give me the opportunity to send you some of the things that I've been looking at, that are, like the Town of Bethlehem thing is not new. The Cortland one, I just found today,
Yeah.
so.
it was passed in January.
January.
So
Oh, yeah.
it's almost
So
two
that's,
years.
Yep.
yeah.
Jennifer, do you have a sense, or did you find on your law center search how many municipalities in the state actually require their own licensing?
It is definitely in, the public health law centers, I was actually just looking at their,
When we took this up a couple months ago, I remember looking that up,
Yeah,
the public health law
It's
center. I
more
can't
than
remember,
10
But yeah.
that have a licensing requirement. It's probably closer to 50 that have either like a licensing or a zoning requirement.
Like, okay.
yeah.
Yeah.
The tendency has been, this just, I think happened in Albany, or maybe a town near Albany. The tendency is to, do zoning because it's easier, but it also doesn't make, it's not as much of an impact.
Okay.
You know, with licensing, then, you do have to enforce it and,
Mm-hmm.
follow up on it. It, theoretically takes more work, but, licensing laws are usually much more effective in terms of like, you do, and again, this is nationwide, but there are, decreases in youth initiation, decrease in use in general. It really can impact, smoking rates and vaping rates.
Yes.
Yeah.
And that's one thing that I found in all of everything that I thought was really cool and would help us quantify the purpose of this, is that you really should be collecting data on the impact of the legislation on smoking rates and, any number of things that this could impact. So that would be like a long-term goal of this.
Right.
Would be to improve, we would be able to quantify, like, we have improved, hopefully, we have improved the wellness of our community. So sort of to your point about like
Yeah.
having a specific goal, this is something that could help us do that.
Yeah, and if it is going to be a kind of phasing, slowly phasing out, then obviously you probably wouldn't see the impact, for a while. But, then again, you never know. Just so you know, so there's an organization called Truth Initiative, which is focused on
It's
not
more of like a-
individuals, it's
Right.
the system,
Yes,
right?
yes.
And the other thing I'm thinking about, just as we move forward with thinking about all of this and licensing and the work, right, that is involved with implementing a program like that, just that we keep that in mind, when we're thinking about what those fees could be. Because we don't want it to just be, like a fee just for a fee, we want it to actually, support, whatever program we institute here,
Yes.
so.
Maybe it could, I mean, if we have, no, that won't work, but I'm just thinking about, if we think about the percentage of maybe an additional police officer, although they do say that it's best enforced by like civil
Yeah.
officers.
Okay.
But yeah, maybe it's a part-time code enforcement officer, that we have to hire in order to do
Or
enforcement.
whatever
so there's some-
percentage of their position time,
Right.
or however that's figured out. I
Yeah.
think that's just something to, for us to, keep in mind.
Put a lot of thought into, for sure. Okay, so I will forward you all, I did just send you the list from the Public Health Law Center that I was looking at that has all of the different municipalities and like the type. And then, so we can consider the types of things that we would like to include in ours, and I'll forward you the city of Cortland. And next time, maybe we'll take maybe we can take the model statute, which is like the most comprehensive one, and strike what we don't want and highlight what we do want, and we'll just go through that.
Sent out already? I know we had a couple things, or is that something?
What I'll do is put together something that's
Okay.
more concise for
Gotcha.
the next meeting.
That sounds good.
Okay, cool, yeah, because we have had a lot of materials.
It's a very helpful model ordinance, but it has
Oh, is
so
that the
much.
one
It's like 30 pages.
Okay,
Yeah.
okay,
Yeah.
that
Yeah.
one,